about 3 or 4 weeks ago, we had the announcement of the largest gift ever provided, grant ever provided, from the Federal Ministry of Industry through the Canadian Foundation of Innovation, a grant of $119 million for this organization to further develop its research and translational research. We'll come back to that, sir. Facilities across our 3 sites. If it wasn't for the work of these foundations, the hard work that you've put in, we simply wouldn't have the matching funds that would allow us to apply for these grants. So thank you so much for what you've done. And I think it's fair to say that it's a terrifically appropriate thing that the Toronto General Western Foundation is holding its annual general meeting this year at this hospital. What a year the Toronto Western has had due to your support. And I want to just go through some of the ways this hospital has progressed, some of the very exciting things underway here, largely through the support of the foundation that you work for. And I'll tell you in advance that there are a lot of pictures here because we want to show you some of the terrific people who work at the Toronto Western, who you're supporting. Of course, the Toronto Western is part of the University Health Network, and our vision is simply achieving global impact. The kinds of programs that we're going to describe to you here at the Toronto Western Hospital, we're proud to say are following that vision of achieving global impact, and we'll give you some of the examples of that success. However, whether you're achieving global impact or not, we feel that every person who works at University Health Network should be able to say they are part of our purpose. And that purpose is to be a caring, creative, accountable academic hospital, transforming healthcare for our patients, for our community, and the world. That's everybody's responsibility at this hospital, and we're proud to have that as our purpose coming to work. If we look at the Toronto Western Hospital, which is run by Kathy Sabo here in the front row, Kathy, if you can put up your hand, Executive Director and Site Lead, reporting to Dr. Catherine Zahn. You can see this is a large part of the Toronto healthcare system. Over 2,000 employees, many, many inpatient days, lots of surgeries, over 16,000 surgeries that go on here, many, many ambulatory visits, as you know if you ever try to find a parking space. Lots of work in the Toronto healthcare system provided, and an extraordinarily proud history at the Toronto Western Hospital from 1896 through the incorporation in 1899, and of course the wonderful groundbreaking ceremonies for the Fraser Fell Pavilion that still bears the Fell name. Subsequent merger of Toronto General and Western, and after that, in the late 90s, the incorporation of Princess Margaret Hospital. The wonderful redevelopment of the Toronto Western campus. In 2002, the Kremble Atrium developed their opening, housing the Kremble Neuroscience Center, and then subsequently the East Wing in 2005. So a wonderful history of success and redevelopment that's only just begun. Many more exciting things to happen. Here are some of the examples of translational research that we were talking about earlier. Investigations that go from the discovery bench to actually being applied in our clinics. Things like heart transplants, performed at the Toronto Western Hospital in 1968. 3D navigation systems that are developed in the laboratory and then allow the surgeon in the operating room to make smaller incisions, guided by imaging, to do better surgery through less invasive approaches. And you can see the list: functional MRI scan, helping us to define the anatomy of the brain, the institute or the adoption of the first gamma knife program in Ontario in 2005, and we're extremely proud to have the first 320 detector CT scan in any emergency department in the world to better serve early diagnosis of patients who are presenting with possible strokes this past year. So lots of firsts at this hospital, including some of the wonderful discoveries in our Kremble Neuroscience program under Dr. Peter St. George Hislop's direction, identification of genes responsible for a variety of neurologic conditions, hereditary blindness, gene mutations identified by Dr. Brenda Galley, causing a disease called retinoblastoma. The terrific work in deep brain stimulation, a collaboration between our departments of psychiatry and neurosurgery, mapping out the functional centers of the brain responsible for so many different conditions, and then trying to change the abnormalities of those areas through deep brain stimulation. Translational research demonstrated by the work of Michael Failings, looking at stem cell research in his laboratory in petri dishes, growing those stem cells up, and then actually implanting them into injured spinal cords, patients showing improved function in those patients. And very, very proud to celebrate 2006, the first clinician scientist in nursing within the neuroscientist program. As you know, at University Health Network, we believe in focus, we believe in concentration. We don't think we can be great, we don't think we can achieve global impact unless we define which areas we're going to invest in and concentrate resources in those areas. And the Toronto Western really has three areas of focus: musculoskeletal health and arthritis program, medical and community care program, and the Krembil neuroscience program. Three areas where we really focus our clinical care delivery. Services which provide support to those areas, of course, are emergency department, medicine and surgery facilities, and what we're here to celebrate today, the Loretta Ann Rogers Critical Care Center. We're going to show some wonderful examples of what Loretta and Ted have allowed us to achieve at the Toronto Western in the past few months. Just to describe to you some of the leaders of these programs, this is Dr. Nizar Mohammed, the medical director of our musculoskeletal health and arthritis program. In orthopedics, we provide a full range of orthopedic services, but where Dr. Mohammed and his team have provided particular focus and energy is providing more total joints, more total hips, more total knees for those patients who have previously been on extraordinarily long waiting lists in this province. You'll remember the terrible stories of people waiting in wheelchairs with crutches for a year, 2 years, waiting for their total hip to be done. I'm really proud to tell you that due to Nizar's work, the work of his colleagues, today most of our total hip and total knee patients are having their surgery within 60 days of meeting their surgeons the first time. In fact, in many cases, we'll offer the patient an appointment. They'll say, no, I need a bit more time. I need a bit more time to organize my life. So we're extraordinarily proud. In the past, Kathy, I think the number is now 1,200 almost. Just 3 years ago, we did 600 arthroplasties at this hospital. This year we'll accomplish about 1,200, doubling the volume of care that's desperately necessary for patients with advanced arthritis. Not only do we have a world-leading orthopedic program, but rheumatologists around the world send their specimens, send their patient material to these doctors, Dr. Daphne Gladman, Dr. Rob Inman, Dr. Simone Corrette, who serve as an international resource. We're looking at serum, blood samples, trying to discover the causes, the genetic causes of rare inflammation, of rare arthritis, or even some of the more common arthritis like rheumatoid arthritis. Specimens literally sent from around the world to the Toronto Western Hospital for those translational laboratory tests that allow us to characterize which patients have which conditions. So again, the Toronto Western is achieving in arthritis treatment that UHN vision of achieving global impact.